No two patients are the same. Every tumor can be a little bit different size, location, consistency, which prompts us to need to change the way that we prepare for surgery.
Right about here is where a lot of the cranial nerves start coming out.
We do, for all patients, prepare a 3D simulation for them to allow them to see before surgery to have a better understanding of their condition and pathology, and we use that for preoperative planning and intraoperative navigation. What I have here is a 3D model. We don't do this for all of our cases, however, some specific tumors do call for a better understanding of their pathology prior to surgery. This was an epidermoid tumor, which is in the posterior fossa. And on a typical DICOM, you can't really see the difference between the tumor and the surrounding cerebrospinal fluid. To prepare for this case, we were able to use a segmentation software and paint the tumor to have a better understanding, and this is on the DICOMs. We then created a 3D rendering of this patient, if we can pull up the 3D rendering, in which we painted the tumor and outline all of the surrounding cranial nerves, which you'll see here represented in different colors. We wanted a better understanding beyond this prior to surgery, so we prepared a 3D model here in-house, and we were able to do a patient-specific rendering of his cranium, as well as surrounding vasculature, tumor, and cranial nerves. And these were each painted a different color. And with this representation, we were able to, in the operating room and before surgery, have a better understanding of where our skin incision should be, where our approach is, and how we're going to dissect the tumor away from each cranial nerve piece by piece. This patient found great understanding of his condition from looking at the 3D representation in virtual reality as well as with this model. Following the surgery, we do feel that having all of this done ahead of time gave us a better outcome for the patient following surgery. He's doing great, he's returned to his life, and he has no side effects from surgery.